And on the heels of National Suicide Prevention Week and as students head back to the classroom full-time, mental health is on the top of mind for a lot of people right now, especially for teenagers.
Yeah, a recent survey by Mental Health American found 54% of 11 to 17-year-olds reported frequent suicidal thoughts or self-harm in August. That's the highest rate since screening began in 2014. So what warning signs should parents be looking out for? Kaiser Permanente psychiatrist Dr. Kathryn Erickson-Ridout joins us now, and we thank you for being here this morning.
Yeah, a lot of teens struggling with anxiety and depression, but that figure that you just read off, Len, more than half of teenagers having these suicidal thoughts. So we had, the pandemic, their worlds turned upside down. Yeah. How can we ease the transition back into normal life?
Absolutely. Like you mentioned, the COVID-19 pandemic is something we never thought we'd deal with in our lifetime and came with a number of changes in our everyday routines and loss and stress. So talking to our youth about their mental health, understanding the warning signs of depression and anxiety, and really helping support our youth through these times are some of the best ways to help prevent suicide and understanding the warning signs.
And a recent CDC study found suicide-related ER visits among teens spiked 31% in 2020. This is compared to the year before. What would you say is driving that increase?
Sure. So there's the CDC data, and we just published a paper using KPIX or Kaiser Permanente Northern California data and JAMA Psychiatry showing similar trends that overall suicide rates have not increased for the population at whole, but particularly for certain groups, adolescent females and then youth without a history of connecting for mental health care. They might have more risk of suicidal attempts or thoughts right now.
Okay, so let's talk about the warning signs here. What should parents be on the lookout for, and at what point should you actually reach out for outside help?
Absolutely. And I think the most important thing parents and friends, all of us can do for each other is be there for each other and keep talking to each other. Some of the biggest warning signs for worsening mental health or suicide include changes in behavior and not being able to do the things you used to be able to do. So if you have a child who was doing really well in school and all of a sudden that's changed, or they're isolating much more than they used to, those are times you would want to think about reaching out.
And this, of course, can be a very difficult issue to talk about, but very important to talk about. It could save lives. What advice would you give parents struggling to talk to their teens about depression and suicide?
I would just say try, right? There's great resources out there like findyourwords.org that can help parents and teens learn their words to talk about mental health and suicide and start those conversations.
All right, Kaiser Permanente psychiatrist Dr. Kathryn Erickson-Ridout, thanks a lot for that.
Thanks.
And if you or a loved one are thinking about suicide, please know that you are not alone and help is available 24/7 by calling the National Suicide Prevention Lifeline. That number for you, 1-800-273-TALK. That's 1-800-273-8255. Or through the crisis text line by texting HOME, HOME, to 741-741.